sure you take our survey. You'll be redirected to it immediately. And that would be very helpful for us because it gives us an opportunity to, one, see how you liked the program, but then also gives us some idea about future programs. So we are going to get started. Next slide. So, well, for those of you who are new to Zero, I'd just like to give you a little bit of background, tell you about us and what we do. Really, and our mission is our name, and that is to end prostate cancer. So we are going to save lives and stop pain and suffering by advancing research, encouraging action, and providing education to support men and their families. And there's been several ways that we do that. And primarily, we work very closely with partners throughout the country, and we have nearly 40 run-walk programs throughout the country this year. And so many races taking place over prostate cancer this month, so I certainly encourage you to check out our website. There may be a race or a run walk near you, and they are great fun. They're family events. They're really exciting, and we do a lot of different things to recognize survivors at each of these programs, and so really a wonderful opportunity. We have a robust government relations and advocacy program. We provide support for research funding. We have a copay relief program for men with castrate-resistant prostate cancer. And we have an education and outreach program series that we run, including programs like our webinar. We have print materials, we have materials online, and also, you know, we're happy if you have resources that of ours that you are interested in. We're happy to send you copies if you'd like to share them. And then we have a free testing database on our site that serves as a resource for anybody who's looking for free or very low-cost testing in their community. Next slide. And with that, I'm going to hand it off to my colleague at UsToo to tell you a little bit about the great work that they do at UsToo.
Thanks so much, Ivy. We really appreciate the opportunity to participate in the webinar, and thank you and the team at Zero. UsToo was founded by and continues to be governed by people directly affected by prostate cancer, which is why our logo includes the question, affected by prostate cancer, UsToo. We are celebrating our 25th anniversary this year, and we had an educational symposium and gala celebration dinner in June, and much of that material will be posted on our website soon, but we'll be celebrating our 25th throughout the year. Our mission really is to provide hope and improve the lives of those affected by prostate cancer through support, education, and advocacy/awareness. Much of the content and value that we bring to the prostate cancer community is on our website, which is ustoo.org. So we've got a lot of information that's available digitally, educational resources and support services that can be found on the website. We also have about 300 support groups and chapters throughout the country and some abroad that provide the opportunity for those who are battling prostate cancer to benefit from others who've been down the same path. We also have a monthly newsletter, The Hot Sheet, and another distribution every month, which is the News You Can Use, which is an RSS feed of prostate cancer news articles. Both of those features can also be found on our website. The online community of Inspire is something that we started that's specific to UsToo. We also have an email exchange noted as Prostate Pointers, and a toll-free prostate cancer helpline, which is also on our website. We also provide the opportunity to match callers with volunteers from our network who have gone down the same road in terms of managing the same side effects or had the same treatment. So we've got a lot of different opportunities to help others who are battling prostate cancer, and please visit our website if you'd like more information, and let us know how we can help you. So back to you, Ivy. Thanks again.
Great. Thank you so much. And we're really pleased to be able to partner with UsToo because you guys do great work, and we really love it. And with that, I'm going to tell you about our two experts. I'm so pleased to introduce you to Meredith Morgan. She is a urologic oncology nurse practitioner at Weill Cornell Medical College and York Presbyterian Hospital. Whew, that's a long one, so I'll let you read about that. But tell you a little bit about the patients that she follows in the urologic oncology survivorship program that she had started up, and most of them have been treated for prostate cancer at some point, and they sorry, I just lost my point. well as my plate. And she is a leader in helping to sort out research in survivorship. She worked very closely with the head of our medical advisory board at Vanderbilt University, where she helped to develop an advanced prostate cancer clinic in the Department of Urologic Surgery. She also helped to men who had a recurrence and also with advanced disease. What's very exciting is that she has been very engaged in several clinical trials for prostate cancer treatments and has really been able to be a part of the change in the shifting landscape with the most recently approved drugs in the past few years. She is also an expert in helping to create patient education materials and is helping us with many of ours. And she also, uses them in the inpatient and the outpatient settings to really help men prepare for their different treatments, and then also particularly in penile rehabilitation following surgery. She comes to us by way of Vanderbilt, where she received her master's in nursing, and also her Bachelor of Science came in psychology from the University of Georgia. So we are very excited to have Meredith with us. And then I'm going to tell you a little bit about Joanne. So my esteemed colleague, Dr. Joanne Buzagio, is the Vice President of Research and Training at the Cancer Support Community. She and I worked there before I joined Zero, and she leads many different programs at CSC, but one of the really exciting piece of programs that she leads is what's called the Cancer Experience Registry, and it's an online vehicle that engages patients and caregivers to inform future priorities in research and innovative programs in healthcare policy. And at one point in her talk, she's going to tell you about the work that both Zero and UsToo are doing with them in support of a prostate cancer survivorship registry, and we're very excited about that. So just a little bit about Dr. Buzagio's experience in addition to the registry and what she does at CSC. She's one of the top 10 behavioral health researchers and clinical psychologists in the country, focusing in psycho-oncology. She has extensive research in development and evaluation of evidence-based interventions that help patients cope with diseases such as cancer. She also was the deputy director at Fox Chase Cancer Center's Behavioral Research Core facility, and has spent really most of her work in psycho-oncology, making sure that the programs that are delivered to people living with cancer are done in a thoughtful way that actually helps to enhance someone's life and improve it rather than do any harm. And so she has been very published throughout the country in many journals and presentations. We are lucky to have her. She got her doctorate at Temple and did a postgraduate fellowship in health services research and development at the VA Medical Center in Philadelphia. Next slide. So with all of that, with knowing who's going to be talking to you about this, we're going to tell you just what to expect in our agenda. We'll talk a little bit about what is survivorship, prostate cancer today, getting a feel for it, talk about the clinical issues that men face being a prostate cancer survivor, and then we'll hear from Joanne as she talks about emotional issues that men face in survivorship. We'll talk to you about some resources that are available in the community, and then we'll have our question and answer period. Next slide. I just want to start the whole program off with this quote from somebody that we work with, and it was really great because, it is my passion to show other men that staying active can help you fight prostate cancer. And that can mean so many things, but it's so important, particularly for those of you who are engaged in the activities that we do at Zero and who are even here today. Staying active can mean, means many things, but for a lot of people it means being informed about programs that are available for you and how to continue, in your survivorship. And so certainly we're all continuing to fight prostate cancer, particularly today, with our program. And with that, I am going to hand it off to Meredith. Thank you very much, Meredith. We're excited.
Thanks for having me, Ivy. I'm excited to be here today. So we're going to begin talking what is survivorship. There are many different definitions of prostate cancer survivorship. Some individuals start their survivorship journey at the time they are diagnosed with prostate cancer. Others define their survivorship starting after they are treated for prostate cancer. So where you see yourself in the spectrum of survivorship is very personal. Everyone's journey is different. But in the same way, you're not alone. There are 3 million prostate cancer survivors out there today. And I think it's important for prostate cancer survivorship to include those living with prostate cancer, not just those that are in remission with an undetectable PSA. If you are living with prostate cancer, you are a prostate cancer survivor. So next slide, please. As you can see from this slide, prostate cancer is the most commonly diagnosed cancer in men, and it is also the second leading cause of cancer deaths in men, just behind lung cancer. Next slide. So now we will turn to the clinical aspects of survivorship. So most men are diagnosed with prostate cancer early when the disease is still organ confined. Obviously, this is the best time for treatment and the best chance for a cure, but if only it were a quick fix. All prostate cancer treatments have possible side effects and complications associated with them. As you can see in this picture, prior to treatment, we have sort of clinical stage 1, and that's when you cannot feel prostate cancer by digital rectal exam. It's not visible by imaging, but it's there. Stage 2, it's identified by a biopsy, and it's still very early. Both stage 1 and stage 2 is organ confined to the prostate. Next slide. So just in the past few years, many new tests have been approved to help guide patients in treatment-making decisions, including genomics testing. So with these additional tests, we may be able to better guide the right patients to active surveillance and the right patients to immediate treatment. So I'm going to speak a little bit about active surveillance first. It is a plan aimed at actively surveying prostate cancer in certain individuals by serial PSA blood tests, digital rectal exams, prostate MRIs, repeat transrectal biopsies, and other tests to follow patients with low-risk prostate cancer without immediately treating them. Anyone who is pursuing active surveillance may decide at some point during their course to elect treatment. Other individuals may always remain on active surveillance and may not ever need treatment. And then we broadly categorize treatment as either surgery or radiation. And as many of you may be aware, the two biggest side effects associated with surgery are urinary incontinence and erectile dysfunction. And then with radiation, possible side effects are bowel and bladder dysfunction as well as erectile dysfunction. Although with radiation, erectile dysfunction, or ED, may take longer to appear or show up. Next slide. So first we'll begin by speaking about surgery. Most patients that choose surgery as their treatment have a radical prostatectomy, which is a surgical removal of the prostate. This can be either robotic, as the picture here shows, or it can be open with a larger surgical incision. Potential side effects are urinary incontinence, or the leakage of urine, as well as ED, and that's defined as inability to obtain or maintain an erection. And then there are also general risks associated with surgery and anesthesia, such as blood loss, infection, heart attack, stroke. And then we'll move on to our next slide to briefly discuss radiation. First, we'll begin by speaking of external radiation. That's the most common type of radiation. And this is when radiation comes from a machine outside the body to radiate prostate cancer tissue inside the body. And the most common method is IMRT, or intensity modulated radiation therapy, which is a form of 3D therapy where the machine moves around the patient as it delivers radiation. And then there's internal radiation, or brachytherapy. You can have implantation of seeds, which are permanent and release radiation at a low dose. And you can also have temporary seeds implanted, which are more of a high dose, that are then removed at a later time. There are also other forms of radiation, like stereotactic body radiation therapy, also known as CyberKnife, and there's also proton beam radiation therapy. So we sort of group all the different kinds of radiation under one umbrella. Potential complications of radiation, urinary incontinence is one, but it is much less likely to occur with radiation than with surgery. Other bladder issues that may occur are radiation cystitis, or irritation of the bladder, which can cause frequency or urgency or an inability to fully empty the bladder. Most of these urinary issues get better after treatment, but some of them can be permanent. And then erectile dysfunction following radiation, as I mentioned before, can be slow to appear, and it can take up to a year to actually show up. But about 50% of men who have normal erections prior to radiation will have ED at 5 years after radiation. And then finally, bowel issues can occur. Radiation proctitis is an inflammation of the genito or the colorectal area, and then radiation can irritate the large intestines and the rectum, and patients may have diarrhea or blood in the stools and even rectal leakage. Again, like the urinary issues, most of these bowel issues are temporary with treatment and then go away after you've completed radiation, but some people do have permanent issues with this as well. Next slide, please. So the majority of patients have good outcomes following surgery or radiation with minimal long-term side effects. But those patients that develop long-term side effects can have major implications on their overall quality of life and their daily function. Next slide. So how do we manage these side effects? We're going to first speak about erectile dysfunction. And I'll sort of use surgery as an example, but after surgery, we recommend a program called penile rehabilitation. And we recommend patients use PDE5 inhibitors, and that stands for phosphodiesterase type 5 inhibitors. And that's basically a fancy word for drugs like Viagra, Cialis, Levitra, Staxin, and Stendra. And we generally don't favor one drug over another, although they do vary a little bit in terms of price and how long it takes for them to start working. But we do recommend a daily low dose beginning 1 to 2 weeks before surgery. You would stop the daily low dose during surgery and while the catheter is in, and then restart the medications after your catheter is removed. And so you would take this low dose every day, and then 1 day a week take a high dose with stimulation. So for example, if you were using Cialis, you would take 5 milligrams a day and then 20 milligrams once a week with stimulation for sort of loading a higher dose. If you wanted to use Viagra, you would use Viagra 25 milligrams a day and then Viagra 100 milligrams 1 day a week with stimulation. And this is recommended to force blood flow to the erectile nerves, which helps with healing and quicker return of erectile function. And we recommend this especially in the 3 to 6 months following surgery. You can also use this during radiation as well, although it doesn't mechanically work the same. The downside to using these drugs is cost. These medications are very expensive, and as many of you know, not covered by Medicare or private insurance. Additionally, they can have some side effects like headaches, facial flushing, or stuffy nose. Also, if you have heart problems, you should check with a cardiologist before starting these medications. And we do not recommend you take these medications if you carry nitroglycerin or take medications with nitrates. Next slide, please. So the second phase of penile rehab is injection therapy. And injection therapy can start as early as 6 weeks after surgery, or it can be used during radiation therapy or following radiation therapy as well. And we strongly encourage patients who have erectile dysfunction following prostatectomy or radiation to use injections. Research has shown that men who engage in injection therapy early and regularly following treatment have better long-term outcomes in regards to erectile function. We believe these men are able to get erections on their own or with oral medication down the road after using injection therapy faster than those who don't use injections. So the medication is injected directly into the penis, into the corpora cavernosa, with a small insulin needle. Most individuals develop an erection within 5 to 10 minutes, and the erection usually lasts 35 to 45 minutes. So we recommend it for 2 reasons. One, it allows men to have erections sufficient enough for penetration early following treatment, and it increases blood flow to erectile nerves to help with the healing process. And so I've listed here 3 main types of injection therapy: trimix, bimix, and alprostadil. And trimix is probably the most commonly used. It has 3 ingredients in it. Some men have pain with alprostadil, and so they do make a compound, the bimix, that takes the alprostadil out. And then there are also alprostadil-only injections that you may have heard brand names like Caverject, and those are just alprostadil only. And so we recommend that men use injections at least once a week, but they can be used 2 to 3 times a week. Possible side effects are pain or discomfort at the injection site and sometimes an aching in the penis. And there's also a risk of priapism, or a long-lasting erection, as well as Peyronie's disease, which is the buildup of scar tissue in the penis, which can cause permanent curvature. So it's important to have a urologic healthcare provider prescribing these medications for you and following you, because there are potential side effects as well. Next slide. A couple of other options for managing ED. One is a vacuum erection device, or a VED, and that is this top picture on the slide. And as pictured, the VED is a device that's placed over the penis, and then using a vacuum, blood is forced into the penis, and then a penile ring is moved to the base of the penis to sort of hold the blood flow in. You would then remove the pump and hopefully have an erection that's sufficient enough for penetration. We recommend men wait at least 6 to 8 weeks after surgery before they use this device, as bruising or injury to the penis can occur early on after surgery. And then another option is a penile implant, or a prosthesis, and that's the second picture on the slide. A penile prosthesis is a large operation, and it does have possible side effects, so we encourage patients to wait 2 years after treatment before deciding on this sort of surgical intervention, because erectile recovery can take 18 to 24 months following a prostatectomy to occur. So we want to make sure you get all of the healing done before we send you off for a surgery. And then, as pictured, there's a pump. There's a reservoir in the scrotum, and you actually pump that, and the reservoir fills up, and a man is able to get an erection basically on command after a penile prosthesis. And then finally, I just want to mention that penetration isn't the only way to be intimate with your partner. There's so many other ways to share love and affection, and sex isn't everything. So we do encourage partners to find other ways to share intimacy. And it's also important to note that surgery or radiation should not take away a man's ability to climax. So many men are still able to achieve an orgasm without stimulation, with stimulation without an erection. So it's important that you know that. Next slide, please. So now we'll switch over to managing urinary incontinence. And we'll first talk about non-surgical options. The first option is Kegel exercises. And guys, you can't do enough of this. We really encourage it early on, even before surgery or after surgery. But it's a lifelong exercise that you can do to maintain sphincter control. And you can also do it during radiation or following radiation as well. And so the second issue is time. The farther you get away from your treatment, the better your urinary control will be. So a lot of times it just takes patience and waiting, because urinary control can take 6 to 18 months to regain. So a lot of it is just giving it some time. The third option is behavioral modifications, and that's sort of common sense things like voiding every 2 hours while you're awake to make sure your bladder's empty, which would decrease leakage. Minimizing your fluids before you go out, minimizing fluids before bedtime, and then just sort of spreading your fluid intake out across the whole day, so you're not drinking all of your 8 glasses of water in one sitting, which could obviously cause worsening of leakage. And then the fourth option is oral medications, and so those are called anticholinergics, and they may assist with some bothersome urinary symptoms such as frequency or urgency or urge incontinence, but they're not without potential side effects as well. Most common side effects are dry mouth and constipation. And then there's a penile clamp, which is also called a Cunningham clamp. This is another thing we do not recommend using for the first 8 weeks after surgery, as your urethral tissue is still healing. But many men use a clamp for a few hours at a time during the day while they're performing a physically demanding activity like mowing the lawn, and it does decrease leakage for short amounts of time. Next slide. And now we'll discuss surgical aspects to manage urinary incontinence. Again, I recommend waiting 2 years before considering surgical intervention, as urinary control can take 6 to 18 months to regain. But the first option is a male sling, and it's a surgical procedure that places synthetic mesh in the body to lift the urethra, which decreases incontinence. And it is generally performed outpatient and only requires a small incision between the base of the scrotum and the anus. It is generally it has general possible complications associated with surgery, such as bleeding and infection. It can cure some men, but other men may go from using 5 to 6 pads a day to only using 2 to 3 pads a day. So it may improve things without totally taking away leakage. And then the second surgical option is an artificial urinary sphincter, and it is a larger surgery with a much longer recovery. This is what is pictured here. But during surgery, an implantable cuff is placed around the urethra, which mimics normal sphincter function, and the patient controls the sphincter by opening and closing it with a bulb that's typically located in the scrotum. Possible complications with this surgery include infection or wearing away or erosion of the urethra. Sometimes they stop working or don't work and they need to be removed or replaced. Next slide. And then we spoke briefly about bowel and bladder dysfunction, which can occur after surgery, but more commonly after radiation. And the side effects from radiation can vary greatly, from a minimal bother all the way to debilitating life change. Again, patients can modify their behaviors and make diet changes, so you can avoid caffeine and alcohol to minimize urinary symptoms, or you can avoid certain foods which are more likely to cause diarrhea. There are oral medications that help with diarrhea or rectal urgency. Some patients may require catheterization in order to empty their bladders, or they may require either they catheterize themselves or have a permanent indwelling Foley catheter. Some patients may also require a suprapubic tube, which drains the bladder from the stomach. And a very small percentage of patients may require surgery on their bowel or their bladder to partially remove them after prostate cancer treatment. So as you can see, there are many issues to deal with in prostate cancer survivorship, but there are also many options to treat or minimize side effects. Next slide. And I'll just briefly speak about recurrence, although this is a big topic as well. So for all prostate cancer survivors, there is a chance that prostate cancer can recur or come back after a primary treatment. Sometimes it can come back within a few months of treatment. Sometimes it can come back years later. And so that's why it is important for patients to continue to follow up with a healthcare provider to check a PSA at least once a year, but much more often in the first 2 years after diagnosis and treatment. And so we define recurrence as a PSA that's equal to or greater than 0.1. So for local recurrence, your healthcare provider may recommend radiation if your primary treatment was surgery. And they may recommend radiation with or without hormonal therapy. And for men who have prostate cancer recurrence outside the area of the prostate, your healthcare provider may recommend hormonal therapy or androgen deprivation therapy. And as you all may be aware, both radiation and hormonal therapy have side effects. And for many, it's just the fear and the anxiety that prostate cancer will return, and that's an issue for many men. And so I try to encourage patients to not think about their PSA between appointments and try to live their lives without PSA ruling it, and only allow themselves to worry when they've made that visit to the doctor and they're waiting to hear their PSA the next day. But for many, I think this fear and anxiety plays a large part in survivorship. And so this slide concludes the clinical aspects of survivorship.
Great, thank you so much. A lot to learn, a lot to take in. And definitely we're going to switch over and start to talk about some of the emotional aspects of prostate cancer survivorship. And obviously, we know that, just hearing the words "you have cancer" sends a whole flurry of emotions into our minds and really upsets our lives. And so cancer, continues to be a part of us even after a diagnosis. And with that, I'm going to hand it over to Joanne.
Thank you, Ivy, and thank you, Meredith. Boy, that was just, I think, a great overview of really all the, sort of the physical side effects and also the treatments for prostate cancer. And when I think about that, I think about, for all those sort of aspects of prostate cancer, there's a kind of emotional component that goes along with it. And maybe that's what I'll be talking a little bit about. What are some of the emotional and social impacts of prostate cancer? But I think more importantly, is what else is out there for people to help them manage some of the again, the sort of social and emotional impacts, and how you can get involved. And just like I was listening to a lot of things that Meredith was saying, that it's better to start treatment earlier. Well, I would say that it's one of my hopes is that we see survivorship as a long process, and that the more you can sort of attend to your sort of social emotional experience, the better your overall outcomes are going to be. So why don't we move to the next slide? Okay. So the good news is the vast majority of people who are impacted by prostate cancer are doing very well. And there are all kinds of treatments that can help alleviate some of the physical side effects. But that doesn't take away from the fact that the kinds of physical side effects that we're talking about, such as urinary incontinence and erectile dysfunction, can have a tremendous impact on a person's sense of well-being, their identity, their social roles, their relationships, and on top of just being worried about the future. And I don't want to leave out the issue of shame. I think that when we think about sort of the masculine identities and roles, being very, being able to have an erection and to be satisfied sexually is sort of central to that. And I think that when I think about my colleague Chris Nelson from Sloan Kettering, he was speaking about this to a group of us and saying that many men sort of deal with this alone and aren't aware that there are effective treatments, and so that they really suffer sort of quietly. And that, I think, part of what we want to say here is there's no reason to do that. That one of the exciting things is there are effective treatments, and that it takes some courage to talk to your healthcare provider about it. But once you do, there are ways in which you really can get help. But really more broadly, there is some strong evidence to suggest that people participate in social support, in sort of peer support and social support, and remain socially active, actually have better outcomes. And I'm going to extrapolate from some research that was conducted by Barbara Anderson at Ohio State University, and this was with breast cancer survivors. But I think much of this is relevant to prostate cancer survivors too. She found that people who participated in group support, social emotional support, it was actually a psychoeducational intervention where people talked about how to talk with your doctor, where they talked about how to manage side effects, where they talked together how to manage your emotions, and got involved with some stress management, whether it be meditation or Tai Chi, and also exercise. And when you follow these people over 10 years, the people who participate in this kind of support, that they had significantly reduced risks for recurrence and even mortality and death. And what she also followed was, people's immune function. And she found that people who participate in this kind of support had much better immune function, and a decrease in anxiety and overall better quality of life or well-being. So again, I think it speaks to the value and benefit that people can have from seeking the support and education that's out there for them. And so, and with that, we can move on to the next slide. So another concept, and I think it runs through, both sort of Zero's mission, I would say UsToo, and also I represent the cancer support community, is this patient active concept, this idea that by becoming empowered, that you can actually better partner with your healthcare team and perhaps improve the quality of your life and enhance the possibility of recovery. And this was an idea that was first sort of articulated by Harold Benjamin back in 1982. But, in the late 90s and early 2000s, there was some research done amongst people who participated in support groups. And what they found is that, people experienced less unwanted emotion, greater hope, and greater confidence to actually be involved in their care. And again, I think that, and particularly those who are listening to this webinar and those who will be accessing it, that is a sign of being patient active, learning, getting the support that you need. And the reality is there are real benefits to doing that. Next slide, please. So what is psychoeducational support? And, there are many different kinds of support. Coming and listening to this webinar is an example of really becoming educated and informed. And when I think about prostate cancer, when I compare it to even other cancers, it's complex from the start, from making a treatment decision, because there's so many different treatment options, and that can be very confusing. And there are decision aids out there that can help with that. We're able to offer open to options through our helpline, where you can speak to a counselor who can really help you prepare a list of questions in your own language, right, that you can take with your doctor. And what we found is it really reduces people's distress and enhances their confidence to ask the questions that they really need to ask their doctors to understand the pros and cons of different treatment options, so that you can really make the best decision for yourself. And so that's one aspect. The other aspect here, and particularly with prostate cancer, we talk about treatment decision support, but also think about support at the end of treatment. We sort of talk about survivorship care planning. And this is something that you can speak to your doctor about, about, okay, what are the things that I really need? What is it that I can understand about what I need to do in terms of what are my next appointments? What do I need to do to, from terms of surveillance? But also, what are some of the things that I need to be doing for myself, including, what diet, exercise, and seeking emotional support. Another, important aspect of sort of psychoeducational support is stress management. There is a lot of evidence to support that, but managing stress and reducing that kind of unremitting stress, it can really benefit you over the long term. And again, whether it is meditation or even exercise, or I'm trying to think, of Tai Chi, yoga, all of these types of activities are really shown to reduce your stress and have an impact on your immune function. And so that's another key component of, I guess, of that umbrella of what we call psychoeducational support. Support groups can be really valuable, and there's so many prostate cancer support groups and peer-to-peer support that you already heard both from Ivy and Chuck about what Zero and UsToo are offering, and I think it's just so important to really take advantage of those programs, because we know that it really does improve your quality of life over the long run. And I don't want to underestimate, social, when I say social activities. I always say this, as human beings, we're social animals. And sometimes, when you're impacted by a diagnosis such as prostate cancer, we can retreat. And again, there's a lot of evidence to show that, being with others and having social contact is tremendously valuable and really improves our overall quality of life and our health. And so we don't want to underestimate that. Why don't we move on to the next slide. So with all of this, another way of getting involved is, in some ways, really helping the cancer community at large understand and raise awareness about what are the specific social-emotional needs of prostate cancer survivors. And, it's a way of advocating and a way of becoming active and helping set the priorities for where we need to be putting resources into developing new programs, into developing new research, and into, really thinking about how we can improve the way in which healthcare is delivered. And, one of the things, again, I'm thinking about my colleague Chris Nelson, who's at Memorial Sloan Kettering, where they have a panoply, a range of all kinds of treatment options for sexual dysfunction. And then when I asked him, well, is this the case when you go out into the community, in other parts of the country? And there was a kind of quiet, because it's wonderful when you can be when you can live close to a comprehensive cancer center, which has all kinds of resources, versus when you are being seen in a community setting that may not have all those resources. One of the ways in which I think it's really important is to raise awareness about where there are gaps in care so that we can really meet those needs for you and for all people impacted by prostate cancer. And so the cancer support community launched what we call the Cancer Experience Registry. And embedded within this registry, this online community, we have a special focus on prostate cancer. And Zero and UsToo are partnering with us to help us understand what are those questions we need to be asking, where are those areas where we need to be raising awareness and understanding better about what our prostate cancer patients' needs and what are the survivors' needs, so that we can develop education and support resources. And so if you look at the bottom of the slide, it says join at www.cancerexperienceregistry.org, and you're going to see on the next few slides that that's because we really want you to join this movement and this community so that we can be learning from you, but also that you can be learning from other people impacted by prostate cancer. It's a place where patients can become engaged and remain engaged. We'll be asking you to answer questions in a survey. But also, we promise that we will be sharing what we're learning with you. You will be the first ones as we begin to learn about where there are gaps in care or what are some of the particular issues. And it becomes a dynamic learning environment for patients, for caregivers. Caregivers can join too, for researchers, and for other advocacy organizations which are very eager to understand where they can put their resources best to create programs for you. And I say this as a unique partnership. It's one of those examples in which organizations like UsToo, Zero, and the cancer support community come together so that we can better understand how we can do what we do better. Next page, please. Next slide. This is what it looks like when you go on. It's, you can go back to the other one, back to the last slide, yeah, where, those actually the people you see up there are actually people who joined the registry. In fact, I'm looking at the man to the right. He's part of our prostate cancer registry. He's one of our advisors. And so we actually work with patients and caregivers and doctors and our advocacy partners and other people to help develop these very thoughtful questions that we hope that will be meaningful to you. We ask you to join. It's fairly simple to do. Next slide. And when you go on, you can see what other people say. We share some of our findings. You're also able, after you complete the questions, to click on and see how other people with prostate cancer are answering your questions. And we'll be sending you reports as we analyze the data. And also, as there are other hot topics come up, we ask you to participate. So this is a very meaningful, exciting program that we hope that you can get involved with, because I think it's another way in which you can, as I said, become patient active and sort of improve your own quality of life. I think that's what I have. Oh, my final slide is really resources for survivors. Both Zero and UsToo and also the cancer support community provide support groups for some people. For some individuals, if there's really sort of a lot of distress, you can seek individual therapy by sharing your story in all kinds of different avenues and advocating. We know that really you can that you can sort of empower yourself to improve your quality of life.
Wow, so much information. Oh, well, thank you, Joanne.
That's it. There you go, Ivy.
Awesome. So much information, both from you and Meredith. We really learned a great deal today. And I just, wanted to kind of pull it all back together and, just share this other quote with you from someone else that we work with. And, just that there are many men who think that they won't ever get prostate cancer, or that it's something that they don't want to talk about. And when I was diagnosed, it felt like I was standing in a football field all by myself. I got involved with Zero and raising awareness because I wanted to help other men from feeling the same way. And clearly, this just really solidifies what, our presenters have been talking about. And so it's really true, just very feelings that are very important, intense, that need to be addressed, and then physical aspects as well. Next slide. And so I just want to give you some resources. We talked about all of this information and how can you, continue to stay engaged and have more information. But we encourage you to connect with us. We are here to support you through your prostate cancer journey and encourage you to use our resources. We have a video series on our website, both for patient education, and we have a series of some of our Zero champions that came to our annual summit this past March. Wonderful stories, people telling their stories, and the education videos, we feature some clinicians and some patients and survivors just talking about different aspects of the disease. We have a monthly e-newsletter. We encourage you to go back to the Run Rock and to really visit one in your area so that you can connect to be part of the awareness campaigns, or become one of our Zero's heroes and share your story with us. Next slide. And if you would like to reach us at Zero, myself, Ivy Ahmed, I'm the Director of Patient Education, and my colleague, Alice Lee, Patient Education Assistant. Feel free to contact us if you want slides or any information or have more questions about the program today. We're certainly available. And also, if you would like to reach out and connect with our partners, next slide, we have put their contact information as well. As Chuck mentioned, UsToo International, their website is ustoo.org, and they have a helpline at 800-808-7866. And then if you want to take advantage of some of the resources and support services that Joanne talked about at the Cancer Support Community, or learn more about the registry, you can visit cancersupportcommunity.org or call their cancer support helpline at 888-793-9355. And with that, it's a question and answer period. So I just wanted to see if there were any questions. If anybody had any questions, please send them through. We do have a couple that have come through. And actually, I just wanted to start, Chuck, with you to, if you could just tell us, somebody wanted to know how they could find support groups in their area, the support groups that you talked about. How would somebody find those actual groups?
All of the support groups are listed on our website, which is ustoo.org. And once on the website, there's a drop-down that's under Take Action, Get Connected, and it's possible to find a support group by state. So They're all listed by city per state, and each of these support groups are all volunteer-led. And there's a leader, a contact person that's listed in the information, along with which includes their phone number along with their email address. But also, if anybody has any questions, please feel free just to call us here at the office at the number that Ivy provided, and we're happy to help identify a support group near you.
Great. And I do have another one, and actually, Meredith, I will field this to you. A gentleman said that his doctor made a lot of the recommendations, talked about many of the post-surgical recommendations for penile rehabilitation that you had talked about, but he didn't follow them. And so he wants to know if it's too late. He's very embarrassed about going back to the doctor. What would you recommend for him to, sort of express his concerns and then get back in touch with his physician? And can, is it possible after that late date?
Sure, we see this all the time. So everyone is different about how, when, and where erectile function is a priority for them. And for many men, they just want to heal from surgery and get their urinary control back before they focus on erectile dysfunction. And so it's never too late. Usually, if it's been a year or two or more since your treatment, the oral medications may not work as well that far out. They may not give you enough boost. But you can start using injections or a vacuum erection device at any time. And just because I've had people come back 8 years after a prostatectomy and say, I'm ready to address this now and start injections. So it's never too late to start injections, and don't be embarrassed with your doctor, because really it's totally up to you. I mean, it's your decision whether you want to start penile rehab at 6 weeks or 6 years. So don't be embarrassed to go back and say, I've had some changes and now I want to address this, because we see that a lot, and it's never too late to address or to try things.
Great. That's really great news to hear that people really have a long time to continue making decisions.
Sure.
And so we have a gentleman who was just diagnosed recently with a PSA of 3.9 and a Gleason 3.4, who's thinking about active surveillance, and sort of has lots of different questions. But it really, I think that the takeaway from the whole from several questions is he's having trouble deciding about treatment, and side effects are very concerning to him, and he wants to avoid them, and he's considering active surveillance. But how would you help somebody really to make their treatment decision and take a look at the decisions and weigh them, and really go about it in a thoughtful manner? And then I actually we'll punt it to Joanne afterwards just to talk about some treatment decision making. But I wanted to start with you, Meredith, how you talk to patients through those decisions.
It's a really difficult decision, and for most people, when they're diagnosed with prostate cancer, they have some time to decide. And by time, I mean many times 3-4 months. Usually prostate cancer is a slow-growing cancer, and so you never should feel like you have to rush into a decision, and you may have some time to think about it. So generally, active surveillance is recommended for men with 3+3, Gleason 6, with a low volume on biopsy, but we do see it in men with Gleason 7 or 3+4. It just depends on the volume. But there's also other tests to help you to decide, like the genomics testing. They can actually send your prostate cancer tissue off for genomics testing to see if it's a high-risk cancer or a low risk, and even more than the Gleason score. That can help guide your decision. There's 3T MRIs of the prostate, which can sort of look at it and tell you how much cancer is in there. So if I were in your shoes, I would not rush into a decision and ask about additional tests that might help you better make your decision whether to do active surveillance or proceed with treatment. And if your physician isn't able to offer those tests, then ask him to refer you to someone who may be able to, because different places may have better access to genomics testing or different imaging services like the 3T MRI.
Great. That's really great information. And I know we are coming up on the end of our time, but it's okay. We've actually gotten some really good questions, and so we might just go over a couple of minutes. But Joanne, could you talk a little bit about, sort of being empowered in, communicating with your physician and some of the treatment decision-making options that you've worked on?
Yeah. So actually, I think that it really is. I think treatment decision making is complex, and so not only do you have all these different tests that Meredith is speaking about, and in prostate cancer you have time, but that doesn't take away from, what does it mean, how do I make a decision? What's the right decision for me? And, we've done a lot of work in that area, and we've developed a program called Open to Options. And anyone can access that through the helpline number that is on that Ivy showed on the page, 1-888-793-9355. And the reason why I give you that number is because we have done a lot of research, a lot of evidence for this program, in which you have an opportunity to meet with a trained facilitator, it can be over the phone, and where they can really help you elicit your questions and about your different treatment options but I think what's really important is also to convey to your doctor and your healthcare team what really matters to you, what are your values and goals, so that they can help frame the benefits and the risks for each treatment option in a way that you really can understand and really incorporate into your decision. I can't emphasize enough how much this program has really helped people sort of reduce that sense of being overwhelmed and help people become prepared to speak to their doctor with really thoughtful questions that are going to help you really identify what's the best treatment for you.
Great. That's super exciting, and that sounds like a wonderful program that people can take advantage of. And it really is a very valuable program. I have one more, we have two more questions, and so one for Meredith. Do injections or vacuum devices work if your nerves weren't spared?
That's a good question. Yes, so a vacuum erection device will work whether you had nerve sparing or not, and injections usually work as well if you did not have nerve sparing, because we've used injection therapy after other surgeries where nerves weren't spared, and so we do know that both of those things can work if nerves were not spared.
Great. Thank you. And I have another question about, so a gentleman who has robotic prostatectomy in 2 weeks, if he starts to use injections afterwards, is there any correlation between the buildup of scar tissue and the propensity to develop keloids?
Good question. So the more often you use injections, so 6 weeks is a good time to start using them after surgery, but the more often you use them, the more likely it is you'll build up scar tissue. We tell people that they can avoid that by rotating injection sites. So try to go on the left side, try to go on the right side, try to move forward, and try to move back. So hopefully by rotating sites, you can avoid keloids or the buildup of scar tissue. But for some people, they may scar more easily. So it's very patient dependent, but we try to avoid it by rotating sites or just using it once a week instead of the 2 to 3 times a week. Will decrease your chance of building up scar tissue.
Great. That was wonderful. And I'm going to take one more quick question, and that was for Joanne. I've got a question from somebody who said that he has many of the side effects that have been discussed, and he's pretty depressed. How would how would he go about finding a doctor or a therapist, and how would he open up that conversation with his physician to get a referral or to just find one? I guess both of them.
Well, I think that's a really good question, because I think it takes some courage to bring it up to your doctor, and I would go to your primary, you can talk to your internist, your primary care doctor, family doctor. They should be trained to help identify, if there's anything, to help direct you to the appropriate level of care. If you're dealing with depression, some of those really sort of, difficult emotional responses. And the other way is, another thought also is to reach out into your community, see if there are support groups, so that we have a place where you can talk to other people like you who are going through some of these things, and you maybe find some comfort, and also some, some ways in which you can learn how to manage some of those ongoing feelings. But I would first and foremost just speak to your doctor They can be very helpful, and if you want to speak to someone, you can ask specifically, do you know, is there a therapist, is there a social worker, is there a psychologist, and if you feel like you need to speak to a psychiatrist. Those are all good questions to be talking to your doctor about.
Great, that's very helpful. And just even to echo, the opportunity if you want to talk with other men like yourself, the UsToo support groups are wonderful places for men to find support, and just very invaluable. And so with that, I'm going to wrap it up. I want to thank everybody for the great questions, and most importantly, thank our partner in this fight, UsToo, and our wonderful speakers, Meredith Morgan and Joanne Buzagio. Your time, your expertise, it has just been great. I think we've all learned a lot, and really look forward to working with you both in the future. As you exit the program, for those of you who are on the web, please take the post-program survey. It is very helpful to us, and we certainly appreciate it. And we're available to help you. And have a great day. Thanks, everybody. Bye-bye.